All Medicare primary care visits were done via telehealth, and compared to less than 0.1% in February. Those are part of the numbers that I think I'll have you get them. So this part you don't have to. You'll get the other section. Thank you. So think of that, compared to less than 0.1%. 0.1%. That's an incredible number. So over 43% of all Medicare primary care visits were done via telehealth compared to, so you went from 0.1% to 43%. That's an incredible, it's an incredible number. The executive order I signed today will also expand healthcare access in rural America. We take care of rural America. It directs agencies to deploy strategic investments in our rural communications infrastructure. And we're working very hard with all of the people in government that are involved with the communications infrastructure so that the telehealth gets very quick and easy access. Additionally, revenue for rural providers varies significantly from month to month, making it difficult for many to stay in business. Many are having a very difficult time. To help fix this problem, my order will create a voluntary Medicare payment system that will give rural hospitals flexibility, really great flexibility, and a more consistent income stream to better serve their patients. Furthermore, I am directing the Department of Agriculture, Department of Health and Human Services, and the Federal Communications Commission. We were just with the heads of each one in the Oval Office just before I came up to the podium to form a task force that will break down barriers to expanding rural health care. This order continues my administration's focus on rural health care. We allocated nearly $165 million through the CARES Act to support nearly 1,800 small rural hospitals who have done an incredible job, as well as $11.5 million to expand technical assistance for rural and underserved areas. We allocated another $10 billion to 2,000 rural hospitals and more than 2,400 rural health clinics. We waived burdensome licensing, certification, and registration requirements, which took tremendous amounts of time. And these are people that had great reputations and great track records for practitioners that serve on the front lines in rural areas, allowing more medical personnel to serve their wonderful patients. We're also, in terms of PPE, ensuring that the state and local areas have the supplies they need. We've been supplying hospitals and cities and states, governors, helping governors at a number that nobody's ever heard of before. 15,440 nursing homes have received a second shipment of personal protective equipment. They're very much stocked up. They're in great shape. They all have the ventilators, all the ventilators they need. They have actually more than they need. And their equipment, medical equipment, is in very, very good shape. They're full. My administration has worked with the private sector to deliver over 100 million N95 respirators, 85 million gloves, and nearly 250 million face coverings nationwide. We continue to make the extraordinary progress that we've been talking about together on vaccines and treatments under Operation Warp Speed, which is very exciting, most exciting. Last week, we distributed 2,979 cases of remdesivir, which is proving to be extremely powerful and good, enough to treat more than 19,000 patients, had great results. This includes 500 cases for Florida, 500 for Texas, 300 for California, 200 for Ohio, and 150 for Arizona and Georgia. And those numbers will be going up rapidly as we move along. Hospitals are reporting an adequate supply of steroids such as dexamethasone that are used successfully in late-stage illness. They've been very good. We're also very encouraged about the prospects for plasma therapies, and that we're working on, and that's a brilliant art. It's really an art. And we launched a national plasma drive last week. I was at the Red Cross building with the American Red Cross and 13 other healthcare organizations. I urge everyone who has recovered from the virus to go to coronavirus.gov, coronavirus.gov, and donate plasma today. We would really appreciate it. This really makes people better. But we need that beautiful ingredient that you that got better seem to have in your veins. You have to go to coronavirus.gov and donate plasma today. It would be tremendous. We really appreciate it if you do it, because we're low. We're low. We could help a lot more people. And it would be a terrific thing. It'll take an hour, maybe a little bit more than an hour, but everybody will be very appreciative. Makes people better. And, you know, you had something very special. You had something that knocked it out. So we want to be able to use it. So whatever you can do, coronavirus.gov. As a result of improvements we've made in treatment for Americans over the age of 18, the mortality rate has declined 85% from its April peak, 85% decline. On vaccines, last week we announced a $2.1 billion partnership with Sanofi and GSX to purchase and produce 100 million doses of their coronavirus vaccine. 100 million doses. This is the sixth vaccine candidate we are proactively supporting. We're supporting numerous companies that are doing very well, having wonderful results, and they're in final stages of testing. There are now 2 vaccines in that final stage of clinical trials in America, with a third vaccine likely to begin phase 3 almost immediately. And we have additional clinical trials scheduled over the next few weeks for a couple of the other companies. These are great companies. These are companies that are not only well-known, they're well-respected, most importantly. We're balancing speed and safety, and we're on pace to have a vaccine available this year, maybe far in advance of the end of the year, and we're mass producing the most promising candidates in advance so that we're ready immediately upon approval. We have our military lined up. It's logistics. It's all about logistics. They deliver a lot of things, including soldiers, but now they'll be doing vaccine. Our general is all ready to go, and he's very excited. And once we have the vaccine approved, fully approved, he'll start the process. They will start the process, and they'll get it out very, very quickly all over the country, and maybe beyond if it works as we think it probably will. By unleashing America's technical and scientific brilliance, we will end this pandemic, and we will hopefully end it very quickly. The therapeutics are very exciting to me, where you can go into a hospital, and whether it's through a shot or a transfusion, you take care of somebody and they get better. That's something to me is very important, and we're doing really well on therapeutics and really well on vaccines. So thank you all very much for being here. We'll take a couple of questions. Go ahead, please.
Thank you, Mr. President. So if I can ask your response to 2 items in the news and ask a COVID question. First, have you been briefed on the incident off the coast of California where the Marines and the Navy Corps hospitalmen who died in a training accident over the weekend?
They're actually briefing me in a little while. We have it scheduled for a little while from now.
You hope to speak to the families?
Oh, it's terrible. No, it's terrible, and we'll be in contact with the families. A thing like that is terrible.
Separately in New York today, the city prosecutor confirmed a criminal investigation into the Trump Organization. Do you have any reaction to that?
Well, I just heard about this. Is just a continuation of the witch hunt. It's Democrat stuff. They failed with Mueller. They failed with everything. They failed with Congress. They failed at every stage of the game. This has been going on for 3.5, 4 years. Even before I got in, this was starting with the Mueller deal. Mueller started a little bit after, but it started with some of the people that you know very well, the names, Strzok and Page, and all of the different people, Comey. This has been going on. This is a continuation of the worst witch hunt in American history, and there's nothing that I know even about it. You know, I had seen that today, just a little while ago, and I said, what's this all about? I know nothing about it, but it's just a continuation of the witch hunt. Didn't work out for Congress, didn't work out for Mueller, didn't work out for anybody. So what they're doing is they send them around to all over the country, I guess, maybe. But it's a terrible thing that they do. It's really a terrible thing. The witch hunt has gone on long enough, okay? What else?
And just one on COVID, you mentioned the vaccine development program. Could you assure the American people that politics and considerations around the election will not interfere in the science?
absolutely.
And you plan on playing a role in just determining how the vaccine will, if there is one, will be distributed across the country? Is that something that you'll
It's
decide?
possible that I get involved, but no, it won't have anything to do with, we want to make people better. We want to send them to the areas that most need it. And I think we're going to have something very soon. It's going good. Jeff? Please.
Mr. President, you said today in a tweet that Dr. Birx was taking bait from Speaker Pelosi. What did you mean by that, considering that she was just describing the facts about the case of the pandemic right now across the country?
Well, I think we're doing very well, and I think that we have done as well as any nation. If you really look, if you take a look at what's going on, especially now with all these flare-ups on nations that they were talking about. And don't forget, we're much bigger than India and China. China's having a massive flare-up right now. India has a tremendous problem. Other countries have problems, and I noticed that in the news, in the evening news, I never read about that. In any of the news, I don't read about the other countries. You're starting to see that other countries are having very big flare-ups. Countries that thought they were over it, like we thought we might be over it in Florida, and then all of a sudden it comes back. They do come back, but I think we're doing very well. I told Dr. Birx I think we're doing very well. She was in my office a little while ago. She's a person I have a lot of respect for. I think Nancy Pelosi's treated her very badly, very, very badly, very nasty. And I'm just referring to the fact that I thought that really they should say the job we've done, whether it's on ventilators or testing. We've tested now over 60 million people. No other country is even close to that. We've tested 60 million people with great, in many cases, about 50% now rapid fire, meaning 5 to 15 to 20-minute tests where you get the result almost immediately. Nobody has anything like that, nobody. And I think we're just doing very well.
Does that mean
Yeah,
you
go ahead,
just to follow up just quickly,
Go
does
ahead,
that mean
please.
you disagree with her characterization, Mr. President?
Go ahead, please.
Thanks, Mr. President. I wanted to follow up on two things that you said earlier in the cabinet room. The first was on TikTok, and the second was on coronavirus. On TikTok, you said that you wanted money for the U.S. Treasury from the
Yeah.
sale. Does that mean you expect the Chinese company to pay the U.S. Treasury directly, or are you talking about?
Either way, whether it's Microsoft or somebody else, or if it was the Chinese, what the price is, the United States should get a very large percentage of that price because we're making it possible. Without us, I use the expression, it's like the landlord and the tenant, and without the lease, the tenant doesn't have the value. Well, we're sort of, in a certain way, the lease. We make it possible to have this great success. TikTok's a tremendous success, but a big portion of it's in this country.
From the sale directly.
It
you
would come
expect
from the
to-
sale, yeah. Whatever the number is, it would come from the sale.
And then you
Which
mentioned
nobody else would be thinking about but me. But that's the way I think, and I think it's very fair.
And you
But
mentioned
we want no security problems with China. It's got to be an American company. It's got to be American security. It's got to be owned here. We don't want to have any problems with security, et cetera. And something could come out. I will tell you, there's a lot of excitement, not only by Microsoft, but by other companies in terms of buying it. So we'll see what happens. But we want, and we think we deserve to have a big percentage of that price coming to America, coming to the Treasury.
Then on the negotiations on Capitol Hill, you expressed some frustration and said you might take executive action to address.
I might do that, yes.
So I was wondering if you could talk about both how you might prevent evictions through executive action, and then also
Yeah, I can do that if I want, and I want to do that. I don't want people to be evicted, and when they're evicted, when they're thrown out of their, whatever the place may be, in many cases they go to big shelters. And if you talk about pandemic, this is a pandemic, and they go to shelters. Number one, they're thrown out viciously. It's not their fault. It's China's fault. It's not anybody's fault. It's China's fault. But number two, and if they are thrown out, they oftentimes will go to a shelter with tremendous numbers of other people, and the virus will spread. And we don't want that.
Are you considering suspending the collection of payroll taxes?
Well, I can do that also through an executive order, so we'll be talking about that. But we're having a very good discussion with Nancy Pelosi and Chuck Schumer. The problem is they want to do bailouts of their various Democrat-run states and cities. And they want a lot of money. They want $1 trillion for that. And so they want to do much more than COVID-related. They want to bail out cities and states that have been in trouble for years of bad management. In all cases, Democrat-run cities. And we don't think that's fair. you understand that. You've heard it before. Yeah, please go ahead.
Thanks, Mr. President. I wanted to ask you about the Justice Department sending federal agents into cities like Chicago as part of Operation Legend. How exactly do you envision these federal forces working alongside local police departments to help stop violent
It's
crime?
not a mass send, but it's sending very talented people to help them with the drugs and the shootings and the guns and the things that are happening. It's not like sending in the National Guard and stopping it cold, which is an example. A lot of progress has been made in Portland, but frankly, sending in the National Guard like we did in Minneapolis, it stopped it cold. From the time we sent that National Guard, they walked down the street. It was over in Minneapolis. Now it may be starting up again. These are Democrat-run cities and states, and it hasn't been a pretty picture to watch. We will help Chicago. We'll help New York if they request, after request the help. But we want to stop the drugs. We want to stop the guns. A lot of the Chicago is guns, but what it is drug-related, gang-related, largely gang-related. With ICE, we send out thousands of MS-13, thousands and thousands of MS-13. We send them back, or in some cases have to put them in prison. They're too violent. They're truly violent. So we're helping out. When you look at what's happening in Chicago and some other cities with the shootings and the killings, they need help. And we haven't met with resistance, I have to be honest with you. I think it's good that we haven't. We're only looking to help them. We're only looking to help. OAN? OAN.
Thank you, Mr. President. In our nation's 243-year history, there has never been a stronger push for mail-in ballots to determine a national election.
Yeah.
Are you considering at any point issuing an executive order addressing mail-in ballots, and why do you think some people are pushing it so hard?
Well, there's never been a push like this for mail-in ballots, and if you look at the New York congressional race, which is a disaster, Carolyn, it's been a total disaster. They're 6 weeks into it now. They have no clue what's going on. And I mean, I think I can say right here and now, I think you have to rerun that race because it's a mess. Nobody knows what's happening with the ballots and the lost ballots and the fraudulent ballots, I guess. I think you probably have to take the Carolyn Maloney race and run it over again. How can you do this? And this is a small race with literally thousands of people, small thousands, and it's all messed up. You look at Paterson, New Jersey, it's all messed up. Almost every one of these, and these are small, easy to control. They should be able to do this easy. Now you're talking about like Nevada, where last 2 nights ago, they went out and in the darkness of night, without people, without having any meetings of the public, without having anything, they approved a ridiculous, you don't have to look at signatures, you don't have to approve anything, you can have double mailings, you can have all sorts of things. Nobody's ever seen anything like it. It's a disgrace. I mean, honestly, it's a disgrace. So it's a very good question. I mean, the mail-in ballots, if you look at just some of the small places, the small races, a congressional race in New York, should be very easy. Normally that would have been announced at 7 o'clock and it would have been down to the wire and everybody would have loved it. If it was at all complex, it would have taken an extra 45 minutes or an hour. They would have announced it a little bit later. They have no clue. This was about 6 weeks ago, and they have no clue what's going on. They've lost ballots. There's fraudulent ballots. How are you going to do that for an entire nation? They're using COVID to try and get the mail-in ballots. Now, absentee ballots are great. Absentee ballots, they have to request them. They go through a process. They get them. But the universal mail-in ballots have turned out to be a disaster. And what Nevada has been doing, if you look over the last few days, you have to look at what they've done. You can have 2 ballots. You can harvest. It's harvesting. So you can take thousands of ballots, put them together, and just dump them down on somebody's desk after a certain period of time. They have something where if you vote, the vote can count up to 7 days later. Well, if the vote's going to count 7 days later, that means if it depends on the one state like Nevada, that would mean simply that you can't have, supposing it's down to that one state, it could be, it's a great state, but supposing it's down to that one state, that means you have to wait 7 days. But they won't have it there. This is something that's so messed up. And by the way, I have to say, the post office for many, many years has been, run in a fashion that hasn't been great. Great workers and everything, but they have old equipment, very old equipment. And I don't think the post office is prepared for a thing like this. You have to ask the people at the post office. But how can the post office be expected to handle? They have regular mailing, and then now on top of that, they have the internet, where you have Amazon and these companies doing, all the buying. Instead of going to a department store, they go buy through mail. So you have massive numbers of purchases now going through the post office, purchases of items and gifts. And that's a tremendous strain on the post office. The post office loses a fortune. It has been for many, many years, for decades. So now on top of it, it has this. And the Amazons of the world and the others, they pay very, very little money. They lose money on the post office loses money, which is ridiculous, on every package it delivers. But now on top of that, and I'm not just referring to Amazon, I'm talking about all of the competitors, if there is such a thing to Amazon. There will be, but if there is such a thing. But now on top of that, you'll have somebody like the governor of Nevada come out with this massive plan out of nowhere to take millions of ballots and send them all over the place. You'll never know who won that state. It'll get messed up just like New York and just like Paterson, New Jersey, and just like many other places. In West Virginia, they indicted a postman for doing something very bad, you know that? But there are many cases all over the country. If you look, you'll be able to find, there's a list of them all over the country, and that has to do with universal mail-in. Again, absentee is great. It works. Like in Florida, they'll do absentee. It really works. But universal mail-in ballots is going to be a great embarrassment to our country.
Is there an executive order on this?
Well, I
one?
have the right to do it. We haven't gotten there yet, but we'll see what happens. We will be suing in Nevada, and that's already been taken care of. We'll probably file something tomorrow. I do want to say that we're going to be introducing a tremendous health care plan sometime hopefully prior to the end of the month. It's just about completed now. In addition, next month we'll be doing the immigration plan. So we'll be doing that in September. We'll be doing sometime during this month the health care plan. And I think that'll be before the end of the month. And I think it'll be very impressive to a lot of people. Thank you very much. Thank
The
you.
Postal Service says it has capacity for the election year. Mr. President, the Postal Service released this statement saying it has ample capacity for the election. That's not true what you just said, Mr. President.
in here, I'm going to give you a little test. Open it. 2, 3, 4, 5. That's 1, 2, 3, 4, 5, 5, 2, 3, 2, 1. Somebody's testing 1. Somebody said Mark Short is going on, and somebody said that you're not hearing the microphone. Okay, that's what I need.